Morgan Allen from Hillcrest Family Services, and today we're going to talk about I caught gonorrhea. STDs can be so interruptive sometimes. They can catch you by surprise. But that's why today's topic is about STIs and how to protect yourself against them. Combating STIs is a community effort, which is why Hillcrest is dedicated to providing free STI testing and treatment for anyone who thinks they might be at risk. If you or someone you know is interested in STI testing at Hillcrest, Hillcrest is here to help with free and confidential services whenever you need them. Today's video is going to dive into the information you should know about the most common STDs. Knowledgeability on infections and diseases is important for not only your health, but your future partners. STD stands for sexually transmitted disease, and STI stands for sexually transmitted infections. Often, STDs begin as infections and later develop into diseases that can impact and negatively affect the body's functioning, though infections can do the exact same thing. So today we're going to use these terms interchangeably.
More than 110 million people in the U.S. are currently living with an STI, and more than 1.1 million people are living with HIV. Each year, an additional 19.7 million people catch an STI. That's more than 50,000 a day, and many of these infections will be lifelong.
1 in 4 sexually active people will acquire sexually transmitted infections over a lifetime. This means anyone who is sexually active, participates in unprotected sex, sexually active with multiple partners, or anyone sexually active with someone who has had multiple partners in the past is more at risk for contracting an STI or an STD. Here's an important statistic for you. Out of all people who are sexually active, teenagers only make up 25% of this group. Yet, out of everyone who is sexually active and gets an STI, teenagers make up 50% of those getting STIs.
Now it's time to talk about sex positivity.
You might be thinking, this is another adult telling me to be afraid of sex. Well, that's not my intention today. People can be sexually active and healthy over a whole lifetime. What's important for you to understand is that sex positivity is a two-way street with sexual responsibility. Being sexually responsible means getting tested for STDs at least once a year, or more often if you're participating in higher risk activities, which we'll get more into what those are later. It's also knowing the common signs and symptoms of STDs and knowing how to protect yourself from them. Now let's get into the nitty-gritty of the most common STIs.
The most common STDs are separated into 3 major categories: bacterial, viral, and parasitic STDs.
Before we get into each of these categories, it's important to know the most common symptom among all 3. The most common symptom of all STDs is no symptom at all. Over 80% of all STIs are asymptomatic. This overwhelming statistic shows why it's so important to be sexually responsible and get tested regularly so that you aren't spreading infection to other people without you knowing. Being sexually active is engaging in any kind of sexual contact with another person. This can include vaginal, anal, and oral sex, as well as close skin-to-skin contact. We want this to be clear because transmitting STIs can happen in more ways than one.
On that note, let's talk about bacterial STDs and STIs.
Our first contestants are chlamydia and gonorrhea.
So, for chlamydia and gonorrhea, if symptoms do occur, they usually appear within 1 to 3 weeks after exposure. However, sometimes symptoms will appear as soon as 2 to 5 days after contact, or it may take as long as 30 days.
Symptoms for chlamydia and gonorrhea are relatively similar, if there are symptoms at all.
For people with vaginas, symptoms can be
abnormal increased vaginal discharge with or without odor, burning sensation when urinating, bleeding in between periods, lower abdominal pain and lower back pain, and nausea and fever. For people with penises, symptoms are discharge from the penis, burning sensation when urinating, burning and itching around the opening of the penis, and painful or swollen testicles. Chlamydia and gonorrhea can be transmitted through vaginal, anal, and oral sex. It can also transmit from mother to child during delivery. So you might be thinking, how common is chlamydia and gonorrhea? Well, according to the CDC and the Iowa Department of Public Health, in 2017, 1.7 million cases were reported in the U.S. for chlamydia and about 550,000 for gonorrhea. In the state of Iowa, 23% of all cases of chlamydia are between the ages of 15 to 19, equaling around 3,419 cases. For gonorrhea, teens make up 13% of all cases, equal to 628 infections. Cases in Dubuque County as of 2018 for chlamydia were 428, and for gonorrhea was 92 cases. This is concerning when in 2016, only 2 years before, those case numbers were 237 for chlamydia and 32 for gonorrhea. While these numbers might feel fairly low, the rate of infections in our community is increasing exponentially. Chlamydia and gonorrhea can be treated with antibiotics. Yet, if they go untreated for a long period of time, they can cause long-term health complications in both males and females, including infertility and lower abdominal pain.
The next bacterial STD is syphilis.
For syphilis, symptoms may appear 10 to 90 days after contact, but on average they appear more around the 21-day mark. Syphilis can be transmitted through direct contact from vaginal, anal, and oral sex. Often the sores from syphilis aren't recognized as syphilis, so someone who has the STD is spreading it without even knowing. Syphilis can occur in 3 stages: the primary stage, the secondary stage, and the late stage. And complications and damages from the late stage can be permanent.
In the primary stage of syphilis, there can be firm, small, round, painless sores or cankers that show up where syphilis has entered the body. There can be just one sore or there can be multiple, and they last about 3 to 6 weeks and can heal without treatment. In the second stage of syphilis, there can appear a rash on the palms of the hands, the bottom of the feet, and can last about 2 to 6 weeks. Now, without treatment, syphilis can last in the body with no signs or symptoms. Signs and symptoms can appear 10 to 20 years after the initial infection. The late stage of syphilis can include difficulty coordinating muscle movement, blindness, paralysis, impotency, dementia, increase of mental disorders, aneurysms, and tumors on the skin and internal organs.
Syphilis can be treated during the primary and secondary stages. Unfortunately, the late stage cannot be treated and can cause some long-term health complications. Again, this is why it's important to get tested regularly for STDs, even if you're showing no signs of an STD. Now, on to our next category, parasitic STDs. The parasites that cause parasitic STIs are microorganisms that can live in or on another organism.
Our first parasite is trichomoniasis, also known as trich.
Trich is caused by a parasite, and the symptoms usually show up between 5 to 28 days for people with vaginas. For people with penises, they don't have any signs or symptoms at all. Trich is a little different than most sexually transmitted diseases, as it is primarily transmitted through vaginal sex only in close contact with the vagina. For people with vaginas, symptoms include yellow or green discharge accompanied with a strong odor, discomfort during sex or peeing, irritating and itching in the genital area. For those with a penis, symptoms may include irritation inside the penis, mild discharge, and a slight burning after peeing or ejaculation, but will more likely not experience any symptoms at all. Trich can be treated with antibiotics. Now let's talk about pubic lice, also known as crabs.
Pubic lice are parasitic insects found in the genital area, living on pubic hair. Crabs are spread through both intimate contact and contact with infested bedding, clothing, or furniture. Symptoms of crabs includes itching in the genital area or anus, depending on the area of contact, and it begins about 5 days after infestations. At times, you may even be able to see eggs or crawling grayish-white lice in pubic hair.
There are medical lotions and shampoos that can be used to treat pubic lice. Now, some of these medications you need a prescription for, and some that you can find over the counter and don't need a prescription. Either way, it's important to understand that medication for pubic lice is not the same as medication for head lice. It's important to know that these medications should only be used on the body parts that they are intended for.
Last but not least, let's talk about viral STDs. These are caused by viruses that infect the body. To remember these, think of the 4 H's: HPV, HIV, HSV, also known as herpes, and hepatitis.
Our first viral STD is HPV. It stands for human papillomavirus. It's actually a group of over 100 different viruses, and only 40 of them are STIs. Now, some don't cause any symptoms at all, and some cause genital warts and cancer.
Warts may appear weeks or even months after sexual contact. HPV is spread through vaginal, anal, and oral sex, as well as close sexual contact. Warts may appear on the penis, vagina, or anus depending on the area of contact. Warts look like small bumps, and they can be raised or flat, small or large, single or multiple, and sometimes appear in the shape of a cauliflower. Symptoms include possible itching, bleeding, burning, or pain along with the warts. Instead of causing genital warts, some strains of HPV are related to cancer. Every year, more than 27,000 people are diagnosed with cancer caused by HPV. Approximately 4,000 women die of related cervical cancer in the United States. Around 53% of adults are unaware of HPV can lead to cancer if untreated.
HPV can cause 6 types of cancer. Cervical and anal cancers being the most common, followed by vaginal cancer, oral pharyngeal cancer, which is mouth and throat cancer, vulvar cancer, and penile cancer.
According to the CDC, approximately 79 million Americans are currently infected with HPV, making it the most common STD in the United States. 14 million people get HPV each year. Most sexually active men and women will get at least one type of HPV at some point in their lives.
Now, there is no known cure for HPV, making it a lifelong disease. Yet there are 3 vaccines that can help HPV-related cancers from happening. All 3 vaccines are available to people with vaginas, and 2 of the vaccines are available to people with penises. Now, these shots come in series of 3 shots, and they're done over 6 months. They are FDA approved, but the CDC recommends that everyone get them between the ages of 11 and 12. Yet the vaccines are available to people with penises until age 21 and to people with vaginas until age 26. The reason for this age difference is because HPV was thought of for a really long time as a women's issue and a women's issue only, which is not true. The next virus on our list is herpes.
There are 2 types of herpes, HSV1 and HSV2. HSV standing for herpes simplex virus. HSV1 causes oral infections like cold sores and canker sores. HSV2 causes genital infections and sores.
Herpes is spread during vaginal, anal, and oral sex, as well as general sexual contact. It can also be spread from mother to child during childbirth.
Painful sores can appear usually within 2 weeks of transmission. These sores can appear on the penis, vagina, mouth, anus, and eyes.
Sores can last from 4 to 21 days, and herpes is most contagious during an outbreak of sores. However, the virus can still pass from person to person when no sores are present. For herpes, the CDC estimates 776,000 new cases each year. There's no cure for herpes, and it can stay in the body for life, though there are medications to reduce the symptoms and make it less likely that you pass herpes to someone else.
Some of you may have already heard of this next virus. It's the human immunodeficiency virus, also known as HIV.
HIV and AIDS appeared in the 1980s and is responsible for the deaths of nearly an entire generation of LGBTQ+ individuals before treatment was developed and made readily available. A red ribbon is used as a symbol to mourn those who died and remember that we are still fighting HIV and AIDS today. Symptoms of HIV include unexplained weight loss, diarrhea, a lack of appetite, persistent fever, and dry coughs. AIDS is the later and final stage of HIV. AIDS stands for Acquired Immunodeficiency Syndrome and is known to be fatal. AIDS symptoms include headaches, development of mental disorders, appearance of a thick whitish coating on the tongue or mouth, an appearance of purple growths on the skin.
HIV can spread through vaginal, anal, and oral sex, and also close sexual contact. HIV can also spread through blood transfusion and contact with infected blood. It can also transmit from a mother to a child during childbirth and breastfeeding.
According to the CDC, 1.1 million people are currently living with HIV. Approximately 50,000 people are infected every year. The Iowa Department of Public Health says 2,647 people are living with HIV in Iowa from 2017. 127 new diagnoses in Iowa, and 31 of those new cases were individuals between the ages of 15 and 24 in 2017. Also, in the same year, 72 people in Dubuque were living with HIV. There are medications known as PrEP that lower the risk of getting HIV for those who are at risk for HIV. It's a highly effective medication as long as it's taken daily as prescribed by doctors. For those living with HIV, can take a medication and should take a medication as soon as they're diagnosed. This medication is called antiretroviral therapy, ART for short. This medication lowers the levels of HIV within the body so that HIV is almost undetectable to tests. This helps this person stay healthy and also allows them to have sex with others and not pass HIV to someone who doesn't have HIV.
On to viral hepatitis. There are many kinds of hepatitis: A, B, C, D, and E. Hepatitis A and B do have vaccines, which Hillcrest can provide, yet most people do get these vaccines at birth. Hepatitis D and E are a little less common, so we're going to focus on hepatitis C today.
Although not exclusively an STD, hepatitis C is the most common bloodborne pathogen in the United States. Hepa means liver and itis means inflammation, so it causes an inflamed liver. There are a few things that make a body more at risk for hepatitis. The most common are autoimmunity, when your system attacks its own body, through bacteria and viruses that are fairly common, and also through toxic damages from medication, drug use, alcohol, and other toxic poisons. Individuals with hepatitis C are either asymptomatic, showing no symptoms, or have mild clinical illnesses. Those with presenting symptoms could experience fever, tiredness, loss of appetite, nausea, abdominal discomfort, dark urine, a yellowing of the skin and eyes, also known as jaundice, and other general flu-like symptoms.
Hepatitis C is most commonly spread through blood, so this can include sharing needles and other drug preparation equipment, as well as it's also a sexually transmitted disease and can spread to babies during childbirth.
So how common is hepatitis? Well, according to the CDC, there are 4.4 million cases in the U.S.
In 2014, around 20,000 deaths were directly caused by hepatitis C in the US.
There's no vaccine for hepatitis C, yet sometimes in some people, hepatitis C goes away on its own. For others, hepatitis C doesn't go away, yet there are treatments that help 90% of the symptoms. Researchers don't yet know why this happens in some people and other people, but we're on our way to figuring that out.
Remember, everything we are talking about today is for the sake of being more sexually responsible, to protect yourself and the people around you.
If anything from this video, please remember ABC. A. Abstinence is the most effective way to protect against STDs. B is for being faithful to one partner, also known as monogamy. Monogamy makes it easier to protect one's sexual health and keep track of your own and your partner's history. C. Correctly and consistently use condoms during sexual encounters to protect against STDs. Being sexually responsible can also include getting tested so you know your status, communicating with your partner if you do have an STD to keep track of your health and their health, and communicating with your partner what safe sex practices you'd like to participate in, and also avoiding engaging in high-risk drug use activity. It's also important to stay in communication with your healthcare provider about your sexual health and your history. And now for our free-form myths and questions box portion, where I will be busting myths and answering questions ad-libbing off script. Oh, great! Okay, let's get this started. Mix it all up here. Okay. Can someone get an STD from kissing? So although kissing is a low-risk activity, you can transmit STDs, as we said, like herpes with, they have the cold sores. So those can be transmitted, as well as the sores from syphilis. But so it's fairly low risk, but it can still happen. What is PID? PID is pelvic inflammatory disease. It can be caused in the female reproductive system. It occurs when, how we said, if you leave chlamydia or gonorrhea not treated for a really long period of time, this can happen in females, and it causes lower back pain, abdominal pain, and it can also have complications with infertility and other pregnancy problems, as well as just long-term chronic pain, which is not fun. So get tested. Can someone get more than one STI at once? Yes, you can. You can get multiple if you contract multiple at one time. Why is it important to get tested? Well, STDs, as I have said, can cause permanent damage to your health and other people's health, and it's just better to know than not know. Better safe than sorry. Can someone get an STI from a hot tub or a swimming pool? This is one of our myths. So only if you're engaging in a sexual activity with someone who already has an STD can you get an STD from a hot tub or a swimming pool. So just as if you were having sex on land versus in water. Who is most at risk for HIV? So it has been a long-term myth, or it was called the gay man's disease, which is not true. Many people can get HIV and AIDS, yet gay and bisexual men are the largest number for new diagnoses in the United States today. Though there are different demographics that are at higher risk for HIV. This includes African American people and Hispanic and Latino people are disproportionately affected by HIV, as well as transgender women who have sex with men are among groups at highest infected with HIV, as well as injection drug users. Good question. Can someone get an STD more than once? Yes, so if you have an STD like chlamydia that can be treated and cured, once you're healthy again, you can get it again if you have sex with someone who has it. So stay healthy, use those safe practices. I got tested for an STI because I had symptoms. Turns out I don't have an STI. What is it? So this is important to go to a health professional and physician and let them know that you were tested for an STI, it's not an STI, and tell them your symptoms, and they can diagnose you with what is hopefully help your problem or what's going on with your body. I have an STD. Did my partner cheat on me? This is a good question. So not necessarily. As we said, many STDs, the signs and symptoms don't show up for some of them. It's like a month. Some of them it's several years. So if you were with your partner only for a few weeks, they might have gotten it. One of you might have gotten it before you were in that relationship, or in their past. So not necessarily, but it's good to communicate with your partner. Where can someone in the area get tested? So at Hillcrest Family Services, you can get tested for STDs and HIV. They're really awesome. The testing is confidential and it's free. And confidential means that they do not notify your parents or your guardians unless you do come back positive with HIV. Otherwise, with any other diagnosis, if you're positive or negative and anything else, it's all confidential. So it's a really great service to use. I'll give you the phone number and their contact information. Really great people. Can douching before or after sex prevent STIs? No. So douching is washing or cleaning out the vagina with water and or soap. It does not prevent STIs. It has been shown that it can increase, because if you're washing it out, you're washing out all the good and the bad bacteria within the vagina, and that good bacteria can help prevent against STIs. So you're increasing your chance for STIs. Good question. What STDs are not curable? So we have talked about that viral STDs are not curable, but they can be treated to a certain extent depending on the stages. Herpes is not treatable, but they can be controlled with antibiotics, and HIV can become undetectable with treatment. How are STD and HIV tests performed? So HIV tests are with a urine sample, and HIV tests require droplet of blood just provided by your finger, no blood draw. Myth: you can tell if someone has an STD. This is not true. Anyone can get an STD. It's not a certain type of person, or they look a certain way. Anyone can get an STD or an STI. Why should someone get tested for STDs? So like I said, anyone can get tested from any type of sex or close skin-to-skin contact. So again, even if you don't think you have an STD, you should get tested just to be healthy, to make sure you keep your partner healthy, your partner's healthy. It's a good thing. Can someone get an STI from a toilet seat? Most STIs can't live outside the body, and they need that body to survive, so it's just not a likely environment for STDs to survive. Very, very low risk, so nothing that you should worry about. Last question. Is using 2 condoms better than 1? No. So wearing more than 1 condom can cause friction, which can cause either condom to break, which makes it less likely to protect you from STDs or from unplanned pregnancy. So only wear 1 condom if you're going to wear one. Thank you for all the questions and all the myths. This is great. Let's get back to the video.
If you or a friend is wondering what resources are available in the area to fight STDs, you can always contact Hillcrest Family Services. We provide services and referrals to testing and treatment for STDs. We also provide free condoms, wound care kits, PrEP referrals, and other supportive resources. Other credible websites to check out for correct information regarding STDs and sexually responsible habits, check out Sex Etc., Amaze.org, Love is Respect, Go Ask Alice, Planned Parenthood, and Teen Health Matters.
You might have a lot of questions that didn't get answered in this video. Have no fear.
Contact Hillcrest Family Services with any questions you have and we'll be happy to answer them for you. Otherwise, we always encourage you to reach out to a trusted adult when facing confusing or complicated topics.
Thank you so much for watching this video. I hope you enjoyed it, and we will be getting more Hillcrest videos out to you soon. Bye!